Hey, Dr. Jeff here with Dynamic Spine Chiropractic. Are you somebody who finds himself still struggling with neck pain? If you do, one of the big questions that always comes up is why does it seem to keep recurring? Why does it always seem to come back? In this video session, this short video, we're going to talk about 3 critical steps that you can take to help fix that problem, okay? So again, why is it recurring, right? If you've gotten massage or chiropractic care, physical therapy, a lot of times that will help the condition, but people are really more worried about a lasting correction. It's okay to have neck pain every once in a while, but you never want it to be something that lasts, honestly, more than a few weeks, right? The idea is to get something that actually fixes the problem. So typically what we see is when a lot of patients come in and they have issues with chronic pain, there's 3 major things we look for. Now, the first one is something is being missed. And what I mean by that is there's actually 3 components to the spine, right? So we have, this is a picture of a neck. We have the actual bones themselves. I'll turn this on. Here's the bones, okay? Now the bones are the column that creates protection for the spinal cord and the spinal nerve roots. Then we have the nerve roots which branch off the spine, and those nerve roots innervate all of the muscles, all of the organs. They basically control the entire body, so those are crucial. The third thing that's not pictured on here is we also have muscle tissue. And then we have discs and facets and other soft tissue that basically creates a balancing structure inside the spine. It's like the pulley system for your spine that's allowing for normal movement, okay? Now the way these 3 work together is critical. First, we have a nerve which runs to and innervates the soft tissue. We're going to use muscle for an example here. So the nerve is actually what tells the muscles to contract or relax, and it tells them how much tone or tension to hold. Okay? Now the muscle tissue is what surrounds and stabilizes the bone. So again, the muscles are the pulley system to the spine that allow for movement and allow for normal function. Okay? And then the bone, most importantly, is the protective mechanism for the nerves. So the bones are what keeps the nerves safe, open, and healthy. Okay? So this cycle is critical. Now a lot of times when people have neck pain, they'll go into a physician, and what happens is they'll treat one region. Right? Maybe it's the muscle, maybe it's the bone. The problem is if you only treat one region, because there's a close relationship to all 3, it will only short circuit the cycle temporarily. What that means is you feel better for a certain period of time, but over time what tends to happen then is the cycle continues because the other areas are not being addressed. Again, all 3 have an equal importance. So it's crucial that you have all 3 areas assessed. That's big tip number 1. Now number 2, we see this, this is extremely common in our office, is the location of the pain is not always the source of the problem. So we have a lot of patients that when they first come in, they may have pain in their neck or they may have pain in their low back, but I always remind them, where you feel the pain is not necessarily where the problem is coming from. To give you a great analogy in the medical field, right? When somebody's having a heart attack, some of the most common symptoms are to have pain in the left arm or the left jaw, right? Now, if they went to the hospital and those doctors treated your left arm, you would die pretty quick, okay? So you need to make sure that you're addressing the source of the problem, not just where you're feeling symptoms. Now, this is an x-ray example of somebody that we had met who had been struggling with left foot pain for years. They had seen podiatrists, they had gotten orthotics, custom orthotics, they had tried generic orthotics, they tried new shoes, they had tried everything to reduce their foot pain, everything but surgery. And we did an examination on them, and when I was sitting down, I was explaining to him, I said, hey, just because you have foot pain doesn't necessarily mean the problem's coming from your foot. So we did the examination, we found some severe abnormalities in his low back and pelvis. We ended up having to take a set of x-rays. Now on this x-ray you can see, this is the pelvic bones here, this is the spine, and as you can note here, these are what's called the femur heads, or the legs, okay? This is the right side over here. Notice the difference in height. The right side height compared to the left side. We have a significant tilt or imbalance in the pelvis here. Now the reason that can lead to foot pain is because when we have a pelvis that's crooked, it's going to shift weight bearing on one side more abnormally than the other. One side's going to bear more weight. In this circumstance, it put more pressure and more weight onto the left hip, the left knee, and of course the left foot. So now going back to this patient who's had left foot pain for years, what we didn't even touch his foot. Didn't do any therapy for his foot, no treatment. We simply took care of the low back, took a new x-ray to know when it was corrected. About 3 weeks after that, foot pain was completely gone. No more foot issues. Again, didn't even have to treat his foot. So the major goal with this that I want to make sure you really understand, just because you have pain in one location in the body does not mean it's coming from that location. And that's a big reason why people develop chronic pain that doesn't seem to go away for a lasting result. Now, the final one is, are you measuring the correction? Now, this one is pretty critical. The best example I can give people for this is in oncology. When somebody develops cancer, they'll do scans to assess what's the extent of the cancer, how far has it spread, right? We have ways to measure that. And then they'll either do surgery to remove the tumors, or they'll do chemotherapy or other natural approaches. And what they do is they basically go in and they're trying to reduce the cancer, but they always take a follow-up scan to know, has this been in remission? Have we gotten all of it? Have we gotten it taken care of, right? The follow-up scans are just as important as the initial scans because they know when it's fixed. The same thing in our industry needs to hold true. And what I mean by that is, for a lot of our patients, we'll take pre and post x-rays, because it's one thing for you to be feeling better and be out of pain, but it's another thing to know when that's actually fully fixed. That's a crucial part to it. Again, we're looking for a lasting solution. Now, whether that's pre and post x-rays, pre and post nerve scans, the major goal of this is it has to be an objective measure. Something that we can measure, something that we can track to know not only when are you feeling better, but when is the problem fixed. Okay, so that is number 3. So in summary, just remember, if you're struggling with chronic neck pain and it doesn't seem to be going away and it's just, there's no solutions that you can find, right? Remember the 3 major things that you have to look for. Number 1, is every component being hit? Nerve, muscle, and bone. That's the most important one. Number 2, to remember, the pain does not equal the problem. Just because you have neck pain does not mean it's coming from the neck. It can come from the head, the shoulders, the jaw. That can reproduce and refer neck pain. So always look for the problem area, not just the pain area. And most importantly, make sure you're measuring that correction. Make sure that your doctor is having ways they know and they can track, when is this fixed, when is this better, when is this going to be something that we've actually corrected long term. So as always, don't fight the pain, fix the problem. I'm Dr. Jeff Watson. Thanks for joining us today.